After the age of 60, one silent problem affects millions of seniors, yet very few people talk about it clearly or explain how to fix it. Poor leg circulation doesn't usually announce itself loudly at first. It starts quietly with cold feet at night, swelling around the ankles by evening, legs that feel heavy when standing up, or cramps that wake you from sleep. Many older adults believe this is just part of getting older, but that belief is exactly what keeps the problem getting worse. As a surgeon who has spent decades treating circulation-related complications, I can tell you this plainly: declining leg circulation is not inevitable, and in many cases, it can be improved significantly with the right movement, done correctly, every single day. To understand why this one exercise works so well, you first need to understand how leg circulation actually functions inside an aging body. Blood travels down into your legs through arteries powered by the heart, but getting it back up is a completely different challenge. Veins do not have strong pressure behind them, especially below the waist. Instead, they depend on a clever system of one-way valves and muscular contractions, primarily from the calves. Every time your calf muscles contract properly, they squeeze the veins and push blood upward. When those muscles relax, the valves snap shut to prevent blood from falling back down. This is why healthy circulation is not just about movement, but about the right kind of movement. After 60, several changes interfere with this system. Muscle mass naturally declines, especially in the lower legs. Tendons stiffen, joints lose range of motion, and many people begin to shorten their stride or avoid full ankle movement because of discomfort or fear of falling. Sitting becomes longer and more frequent. All of this means the calf muscles stop contracting through their full range. When that happens, blood begins to pool in the lower legs. The veins stretch, valves weaken, and circulation becomes slower and less efficient. That heaviness you feel is not weakness, it's congestion. This is also why walking alone often fails to fix the issue. Casual walking, especially indoors or on flat surfaces, frequently does not activate the ankle joint deeply enough. Many seniors shuffle without realizing it. The heel barely lifts, the ankle barely flexes, and the calf muscles remain understimulated. From a surgical perspective, this is one of the most common hidden problems I observe in older patients. They believe they are active, yet their circulation tells a different story. Another critical factor is oxygen delivery. When blood flow slows, tissues receive less oxygen and fewer nutrients. This leads to fatigue, slower nerve signaling, and decreased balance. Over time, it becomes harder to stand from a chair or feel steady on your feet. The brain senses instability and responds by further limiting movement, which worsens circulation even more. It becomes a self-reinforcing loop. The goal is to interrupt this cycle by restoring the muscle-driven pumping action that gravity has taken away. Research in vascular health consistently shows that targeted ankle and calf activation improves venous return more effectively than general movement. Physical therapists often use this principle in post-surgical patients to prevent clots, swelling, and stiffness. The same physiological mechanism applies to seniors at home. When the calf muscle contracts fully and rhythmically, it can move more blood per minute than the heart alone can manage from the legs. That is not an exaggeration. It is why surgeons consider the calf the second heart. The exercise I'm about to show you focuses specifically on controlled ankle movement combined with deliberate muscle engagement. This signals your veins to function properly, encourages valve closure, and improves the elasticity of vessel walls over time. Importantly, it also improves proprioception, your body's ability to sense where your feet are in space, which is essential for balance and fall prevention. Safety is another reason this approach works so well for seniors. High-impact exercises increase injury risk and inflammation, which can actually worsen circulation. This method is low-impact, joint-friendly, and adaptable to nearly any mobility level. Whether you are sitting, standing with support, or gradually rebuilding strength, the same circulation principles apply. In the next section, I will guide you through the exact exercise step by step. You'll learn how to position your body, how fast to move, how to breathe, and how long to perform it to stimulate circulation without strain. This precision is what transforms a simple movement into a powerful daily tool for keeping your legs healthy, responsive, and dependable as you age. Now let's go through the exercise itself in a clear, safe, and precise way so you can get the full circulation benefit without risking strain. This movement is often called a controlled heel raise with ankle pump activation, but don't let the name distract you. What matters is how deliberately you perform it. You can do this exercise seated in a sturdy chair or standing while holding onto a counter or the back of a chair. If balance is a concern, start seated. Even surgeons and physical therapists begin this way with high-risk patients because seated execution still powerfully activates circulation. Begin by placing your feet flat on the floor, hip-width apart. Sit tall so your chest is lifted and your shoulders are relaxed. This posture matters because slouching reduces nerve signaling to the lower limbs. Take a slow breath in through your nose. As you exhale, press the balls of your feet firmly into the floor and slowly lift your heels as high as you comfortably can. This upward phase should take about 3 full seconds. You should feel a firm contraction in the calves, not pain or cramping. This is the muscle squeeze that pushes pooled blood upward against gravity. Once your heels are lifted, pause at the top for 1 to 2 seconds. This pause is critical. It allows the veins to fully empty and the valves to close properly. Many people rush through this part, which reduces effectiveness. Then, slowly lower your heels back down over another 3 seconds until they touch the floor completely. As your heels lower, gently pull your toes upward toward your shins, creating a stretch across the front of the ankle. This controlled return helps refill the veins with fresh blood and prepares them for the next pump. Breathing is often overlooked but plays a powerful role here. Avoid holding your breath. Inhale as you prepare, exhale as you lift, and breathe naturally as you lower. This rhythm improves oxygen exchange and prevents spikes in blood pressure. If at any point you feel dizzy, stop, sit back, and breathe normally. Perform this movement for 10 to 15 repetitions at a slow, controlled pace. Quality matters far more than quantity. 2 to 3 sets per day are ideal, especially if you spend long periods sitting. Many seniors benefit from doing 1 set in the morning to reduce stiffness, 1 in the afternoon to counteract sitting, and 1 in the evening to decrease ankle swelling before bed. For those who are able to stand, the same motion applies. Hold on to a stable surface, keep your knees slightly soft, and distribute your weight evenly. Standing increases muscle activation, but only attempt this when you feel steady. Never rush progression. Circulation improves with consistency, not force. If you experience mild muscle fatigue or warmth in the calves, that is a positive sign of increased blood flow. However, sharp pain, severe cramping, or numbness is a signal to stop. Seniors with advanced vascular disease, recent surgery, or severe neuropathy should consult a healthcare professional before starting any new exercise, even a gentle one. Research shows that when this exercise is done daily, it improves venous return, reduces ankle swelling, enhances balance feedback, and helps maintain muscle mass in the lower legs. Over time, blood vessels become more responsive, meaning they expand and contract more efficiently. This is exactly what we want as we age. In the next section, I'll explain what changes you can realistically expect over the first days, weeks, and months, how to tell if circulation is improving, and why small improvements in blood flow often lead to surprisingly large gains in comfort, stability, and confidence in everyday life. Once you begin practicing this exercise consistently, the changes often appear subtly at first, but they build in a way that profoundly improves daily life. Within the first few days, many seniors notice a sensation of warmth returning to their feet and lower legs. This is not imagined. It reflects improved blood flow and better oxygen delivery to tissues that may have been undersupplied for years. Cold feet at night are often one of the earliest symptoms of circulation decline, and when that begins to fade, it's a strong sign the muscle pump is reawakening. Within 1 to 2 weeks, ankle swelling commonly begins to decrease, especially by evening. This happens because fluid is no longer pooling as heavily in the lower extremities. When veins function more efficiently, pressure inside them drops, and excess fluid is reabsorbed back into circulation instead of leaking into surrounding tissues. Seniors who previously needed to loosen shoes at night or noticed sock imprints around the ankles often report a visible difference during this phase. Another change that surprises many people is improved balance. This exercise doesn't just move blood, it strengthens the communication between your feet, ankles, and brain. Improved proprioception helps you sense the ground more accurately, making standing and walking feel more secure. This is why targeted calf and ankle activation is a cornerstone of fall prevention programs in geriatric medicine. Balance is not just a matter of strength, it's circulation and nerve feedback working together. By the 3rd or 4th week, nighttime leg cramps and restlessness often decrease. Poor circulation contributes to cramping by allowing waste products like lactic acid to accumulate in muscle tissue. When blood flow improves, these byproducts are cleared more effectively. Better oxygenation also supports muscle relaxation during rest. Seniors who once woke multiple times a night with tight calves frequently experience longer, deeper sleep as circulation normalizes. Energy levels during the day can improve as well. When blood returns more efficiently to the heart, overall cardiovascular workload decreases. This means your heart doesn't have to work as hard to maintain circulation, leaving more energy for daily tasks. Activities like standing from a chair, climbing a few steps, or walking short distances begin to feel less exhausting. These gains may seem small individually, but together they restore confidence and independence. Over months of consistent practice, blood vessels themselves adapt. The inner lining of veins and arteries becomes more responsive, improving elasticity and valve function. This is supported by research showing that regular, low-intensity muscle contractions promote endothelial health, which is essential for long-term circulation. Seniors who maintain this habit often slow or halt the progression of varicose veins and chronic venous insufficiency, conditions that are otherwise difficult to reverse. It's important to understand that progress is not linear. Some days may feel better than others, and that is normal. Factors like hydration, sodium intake, medications, and how long you sit during the day all influence circulation. What matters most is consistency. This exercise works because it provides frequent, reliable stimulation to a system that depends on repetition. If you ever notice increased swelling, persistent pain, skin discoloration, or sores that do not heal, those are signs to seek medical evaluation. Exercise supports circulation, but it does not replace proper diagnosis when serious disease is present. Used correctly, however, this movement becomes a powerful preventive tool, one that many seniors wish they had started years earlier. In the final section, I'll show you how to build this exercise into a simple daily routine, how to combine it with smart habits that protect circulation, and which common mistakes can quietly cancel out your progress if you're not aware of them. To make this exercise truly effective long-term, it must become part of a daily rhythm rather than something done randomly. The body responds best to regular signals, especially when it comes to circulation. The simplest and most sustainable approach is to attach this movement to moments that already exist in your day. Performing it shortly after waking helps clear overnight pooling and stiffness. Doing it again after long periods of sitting, such as after meals or watching television, prevents blood from stagnating. An evening session helps reduce swelling before sleep and supports more comfortable rest. This consistency trains your vascular system to remain responsive instead of reactive. Pairing the exercise with smart circulation habits multiplies its benefits. Hydration plays a major role, as blood becomes thicker and flows more slowly when you are dehydrated. Seniors often underdrink fluids unintentionally, which worsens leg heaviness and cramping. Gentle movement throughout the day, even brief standing or ankle motion every 30 to 60 minutes, keeps the pump active between exercise sessions. Elevating the legs slightly when resting, without sharp bending at the hips, further supports venous return. There are also common mistakes that quietly cancel progress. One of the biggest is rushing the movement. Fast, bouncing heel raises do not allow the veins to empty fully or the valves to function correctly. Another is gripping the toes or clenching the feet instead of engaging the calf muscles. This shifts effort away from the pump we're trying to activate. Holding the breath is another frequent issue, especially among seniors concerned about balance. Breath holding increases internal pressure and interferes with blood flow. Smooth, relaxed breathing keeps circulation steady and safe. Overdoing the exercise is another trap. More is not always better. Excessive repetitions can fatigue muscles and irritate joints, especially in people with arthritis or tendon stiffness. The goal is gentle, repeated activation, not exhaustion. If your calves feel sore rather than pleasantly warm, reduce volume and focus on slower, more controlled motion. Footwear also matters more than most people realize. Shoes with rigid soles limit ankle motion and reduce calf engagement throughout the day. When safe and appropriate, using flexible footwear indoors or doing the exercise barefoot improves sensory feedback and muscle activation. This enhances both circulation and balance. Pay attention to signals your body gives you over time. Improvements like reduced swelling, warmer feet, steadier standing, and less nighttime discomfort indicate progress. On the other hand, increasing pain, skin changes, or asymmetrical swelling should never be ignored. Those are signs that require medical evaluation. Exercise supports circulation, but it should never be used to push through warning symptoms. What makes this approach powerful is that it restores a function your body was designed to use. You are not forcing circulation. You are reactivating it. Age does not prevent improvement. Lack of targeted stimulation does. I have seen patients in their 80s regain comfort and mobility simply by respecting how their bodies work and giving them the right signals daily. If you commit to this one movement and apply it consistently, you are investing in independence, stability, and quality of life. Strong circulation supports every step you take, every time you stand up, and every night you rest without discomfort. This is not about reversing time, but about using knowledge and precision to age with strength and confidence. Here's what most seniors don't realize. Blood does not naturally flow upward from your legs to your heart on its own. Gravity works against you, especially when you sit for long hours, watch television, or sleep with minimal movement. Your body relies on something called the calf muscle pump to push blood upward. The problem is that after 60, this pump weakens rapidly if it's not used properly. Walking helps, yes, but for many seniors, walking alone no longer activates this pump strongly enough, especially if steps are short, slow, or painful. That's why people can walk daily and still have swelling, numbness, or discoloration in their lower legs. Poor leg circulation is not just uncomfortable. Left unchecked, it increases the risk of varicose veins, skin breakdown, slow wound healing, balance problems, and in severe cases, dangerous clots or infections. I've seen patients lose mobility not because they were too old, but because circulation failure slowly robbed their legs of strength and oxygen. The good news is that the human body responds incredibly well to the right stimulus, even in the 70s, 80s, and beyond. Today, I want to reveal one exercise that directly targets the circulation mechanism most seniors are missing. This is not strenuous. It does not require gym equipment, special shoes, or long workouts. In fact, it can be done sitting down or holding onto a chair. What makes this exercise powerful is that it restores the natural pumping action that moves blood out of the lower legs, reduces pooling, and signals your blood vessels to stay elastic and responsive. If you've been told to just move more without clear instructions, you're not alone. Vague advice rarely works. Precision does. When this one movement is done the correct way, at the right tempo, it mimics what surgeons and physical therapists aim to activate during recovery after vascular procedures. Seniors who perform it consistently often notice warmer feet, reduced swelling, less stiffness in the morning, and better balance when standing up within just a few weeks. Before we move forward, let me be clear. This is not a replacement for medical care if you have severe pain, open sores, or diagnosed vascular disease. But for the majority of adults over 60 experiencing early or moderate circulation decline, this exercise addresses the root mechanical issue instead of just masking symptoms. In the next part, I'll explain exactly how leg circulation works inside your body and why this single exercise outperforms many traditional approaches when it comes to keeping your legs strong, nourished, and reliable as you age.